Okay, so my name is Pedro Ortiz, and I'm going to hopefully and successfully present to you and speak to you about schizophrenia, what it is, causes, symptoms, and all that good stuff. So, hopefully, by the end of the presentation, you know all this. So, although schizophrenia is not as common as other mental disorders, the symptoms can be very disabling. Schizophrenia is a serious mental illness that interferes with a person's ability to think clearly, manage emotions, or make decisions. It is a complex long term medical illness affecting about 1% of Americans in the whole wide world. Symptoms of schizophrenia usually start between ages 16 and 30. In rare cases, children have schizophrenia too. The symptoms of schizophrenia fall into three categories: positive, negative, and cognitive. And I will be speaking about positive symptoms right now. In about right now. Positive symptoms. Positive symptoms are psychotic behaviors. They're not generally seen in healthy people, such as hallucinations, delusions, thought disorders, or movement disorders. Thought disorders are unusual or dysfunctional ways of thinking. Movement disorders are agitated body movements. Hallucinations. Hallucinations include a person hearing voices, seeing things, or smelling things others can't perceive. The hallucination is very real to the person experiencing it, and it may be very confusing for a loved one to witness. The voices in the hallucination can be critical or threatening. Delusions are false beliefs that don't change even when the person who holds them is presented with new ideas or facts. A good example would be that a person with schizophrenia sees a sign or poster and they think the message is directly towards them, so they might get offended or angry. Thought disorder, it involves impairment in the form or manner in which a speaker presents thoughts to a listener, and it's characterized by clinical signs such as illogical thinking. Thought disorder represents abnormal organization, control, and processing of the information. Movement disorders are neurological conditions that cause problems with movement. There are many different movement disorders. Some of the more common types include ataxia, dystonia, Huntington's disease, Parkinson's disease, and Tourette syndrome. Negative symptoms are ones that diminish a person's abilities. Negative symptoms often include being emotionally flat or speaking in a dual, disconnected way. People with the negative symptoms may be unable to start or follow through with activities, so they won't have much effort or willingness to do stuff, and they'll be very negative. Cognitive issues or disorganized thinking. Um, it consists of people who often struggle to remember things, organize their thoughts, or complete tasks. Commonly, people with schizophrenia have anosognosia or lack of insight. Research suggests that schizophrenia may have several possible causes. There are several factors that contribute to the risk of developing schizophrenia, such as genetics, environment, brain chemistry, and substance use, such as drug or alcohol. So, genetics. Schizophrenia isn't caused by just one genetic variation, but a complex interplay of genetics and environmental influences. While schizophrenia occurs in 1% of the general population, having a history of family psychosis greatly increases the risk. Environment. Exposure to viruses or malnutrition before birth, particularly in the first and second trimesters, has been shown to increase the risk of schizophrenia, inflammation, or autoimmune diseases, and it can also lead to increased immune system. Brain chemistry. Problems with certain brain chemicals, including neurotransmitters called dopamine and glutamate, may contribute to schizophrenia. Neurotransmitters allow brain cells to communicate with each other. Networks of neurons are likely involved as well in this process. Substance use. Some studies have suggested that taking mind altering drugs during teen years and young adulthood can increase the risk of schizophrenia. A growing body of evidence indicates that smoking marijuana increases the risk of psychotic incidents and the risk of ongoing psychotic experiences. While there's no single physical or lab test that can diagnose schizophrenia, what they do is that a healthcare provider evaluates the symptoms and the course of a person's illness over 6 months, and they help ensure a correct diagnosis. There is actually no cure for schizophrenia, sadly, but it can be treated and managed in several ways. Because the causes of schizophrenia are still unknown, treatments focus on eliminating the symptoms of the disease. And antipsychotic medications are usually taken daily in a pill or liquid form. Some antipsychotics are injections that are given once or twice a month. Some people have side effects when they start taking medications, but most of those side effects go away after a few days of taking them. If not, they should go see their doctors. So, psychosocial treatments. These treatments are helpful after patients and their doctor find a medication that fits best for them. They learn to cope and use. They learn to use coping skills and address the everyday challenges of schizophrenia and help people pursue their life goals. So, coordinated specialty care, it's a treatment model that integrates medication, psychosocial therapies, case management, family involvement, and supported education and employment services. They all aim at reducing symptoms and improving quality of someone with schizophrenia. What can you do if a family member or loved one has schizophrenia? The best thing is just caring for them, like being loving, respectful, and understanding and patient. You need to understand that what they have is it's an illness, and you need to be patient with them. Thank you for listening to me, my stutters, my accents, and my mispronunciations. And this is my presentation.